Well, I guess, like it or not, I gotta go. So I'm trying to mimic the medication administration station. This is from the Blackboard, the self-check scenario, the one on Scenarii Vastas. I did set this up a few days ago and tried to forget the medications that I set up so I could try to make it as real as possible. I have not done this before. So, let's see, I have not read this far before, is what I mean. I did peek to set up the medications because I had to. So this patient, he's in the hospital, he's 61 years old. He has a urinary tract infection, nausea, vomiting, dizziness, blood loss. He has a history of heart failure. Oh, you know what? Forgot to start the timer. 35 minutes. There we go. So we'll start again. So the CE tells me to go. I have to start reading this. I don't know anything about this person. Okay. 61, blood loss. He has a history of heart failure, diabetes, celiac disease, and reflux. So those are his histories. I'll need to know those for the indications. He was admitted. He's had nausea and vomiting. He's dizzy when he moves. He has an order for meclizine every 6 hours as needed. He was medicated last at 1400 with 25 milligrams and reported less vertigo within 30 minutes. At this time, the patient has no vertigo. Patient is voiding cloudy yellow urine, reports pain with urination. He has an IV running, 0.9 sodium chloride infusing at 125 milliliters per hour via a PIC in the right forearm. It was reinserted yesterday at 2100. There's no redness or swelling. I am going to be giving the 1800 medications. So I want to go to my MAR, which I have right here, and the 1800 medications. So it looks like I'm going to be giving Lantus 4 units. Hold if his blood sugar is 150. So Lantus, I want to look for the patient's blood sugar. I'm pretty familiar with these S bars from previous ones. I know that I want to find the glucose. So it was 135. So it's okay to know, sorry, less than. So his blood sugar was 135. Hold for finger stick less than 150. I just want to double. So this is where all the time gets eaten up. 135 today. Yesterday it was 275. Glucose 135. What threw me off is because this is saying it's high, but this is saying to hold. That just, even though I know that that is a normal, it just threw me off for a second. So I'm actually not going to be giving this. I'm going to be holding that. Okay, the next one, Lasix, 40 milligrams. IV push over 1 minute. Give it every 12 hours. Flush with 3 milliliters of sodium chloride before and after the medication. So Lasix 40 milligrams IV push. So what do I want to check? His potassium maybe? His potassium 4.0, which is normal. So that's fine. I should maybe just want to, I guess maybe check his blood pressure just to make sure it's not too low. Normally I would hold Lasix if a low blood pressure. 130, 128, 124, those are all fine. Heart rate. Just kind of look to see where he's running for his vitals. I never really did that. Just to look, see where, so his potassium. His white blood cells are high, his H&H is low, he has a hemoglobin at A1C that's high, platelets are fine, his INR is low. Okay, so I am going to be giving the Lasix. And again here it says that he has congestive heart failure. So Lasix is a diuretic, and I'm giving for CHF. labs, and I checked his potassium, his blood pressure, his heart rate, his BUN. Okay, insulin, we checked the blood sugar. That's because he's a type 2 diabetic. And then I want to write here my name and my student number, my Excelsior number. I'm just kind of fibbing it here because I don't really want to write it on the internet. So I am going to be giving furosemide 40 milligrams. I'll just leave that for now. 40 milligrams IV push. 40 milligrams IV push over 1 minute. And I am flushing. Just put it right a note. Flush 3 mLs of sodium chloride before and after. All right, the next one is Prilosec, 20 milligrams by mouth twice a day. It says here that he has GERD, and Prilosec is, I think I have Prilosec marked in my book, just to make sure I spell all that out correctly. No, I don't. I thought I did. I gotta do that. Prilosec. I can never find medications when I'm under pressure. Prilosec 1931. Proton pump inhibitor. That's what I wanted to look up. So he's taking it for GERD, but it's a proton pump inhibitor. Okay. I really can't think of any vital labs or vital signs with that. All right, the next one that he's taking is amoxicillin, 500 milligrams by mouth twice a day. So what was he admitted for again? A urinary tract infection. So my guess is he's taking an antibiotic for a urinary tract infection. And I remember his white blood cell count was either high or low. I remember it was off. So it was 1,500, which is high. So his white blood cell count. Sorry, I don't want to touch over here too much because I'll screw up the camera. If I even bump that, it's over. White blood cell count is elevated. Blood work, maybe a temperature, vital signs, maybe just to check his temperature. Temperature was 99.5 was the last one. Okay. And then it says that he's taken vitamin K, 5 milligrams by mouth 2 times a day, hold for an INR less than 1.2. I believe that his INR was only 0.5, which I remember even just now when I said vitamin K, I was thinking, why would we be giving that? His last INR was 0.5. This says hold INR if 1.2. So that just seems kind of odd because now that I think of it, there's 2 medications here that I'm supposed to hold, and I don't know if that's right. Insulin, 4 units, twice daily. Hold for fingers. Blood sugar less than 150. His blood sugar was 135. That doesn't seem fair because I need to give give both of those to really test the time. But anyway, we'll just go with it. So I am going to hold the vitamin K. I know that it's usually given to people for high coumadin levels because it has the adverse effect for the coumadin. Oh, I have to look that up too. I want to make sure I write the right thing. Well, I'm just going to write that, reverse coumadin. I'll look that up later. And the INR was 0.5. So we're going to hold. Okay, so so I'm giving Lasix 40 milligrams. I got that written down here. I'm going to be giving omeprazole 20 milligrams by mouth, and amoxicillin 500 milligrams by mouth. The vitamin K I'm holding, so I'm only actually giving 3 medications. So just to make it, I'm going to get the 2 oral ones out first. Got 2 medication cups here. I probably should have washed my hands before I even started, but I didn't. I think the critical element is that you have to wash them before you ID the patient and you begin to draw everything up. But I'm just going to go ahead and oh no, my baby's crying. Okay, so I want 20 milligrams of omeprazole. He stopped crying. Okay, 20 milligrams omeprazole. And I wanted to, I'm sorry, I should have shown you that I have different names here. I do need to check that I have the right medication bin. So Vistus Siri. His medical record number is 157896, and then for date of birth it just says 61 years old. All right, and then I also want amoxicillin 500. Amoxicillin. Okay, I have 250. Amoxicillin 250, so 2 tablets of amoxicillin. Okay, so now those are all ready. The next thing though that I need is my flushes, 2 flushes, and I need 40 milligrams of Lasix IV push. Lasix. All right. Just checking because I have some from before. So this says I have 100 milligrams and 10 milliliters, and I need to give 40 over X. So 400 equals 100X divided by 100 divided by 100. So I'm going to give 4. And I think, especially because it's just always a good idea to check your math. $400 divided by 100 equals 4. So 4 mLs. Okay. So again, I'm going to clean my hands here. I like to kind of pull these back a little bit before I take it out because I can't do it right without touching that. So I keep it kind of sterile and just kind of break the seal. Come on. All right, I guess. It's not letting me. And I'm going to go over the trash can. I'm sorry, I know you can't see me, but I'm holding it up high and going over to the trash can and flushing it to the 3 ml mark. So you can see that is right at the 3. Hopefully you can see that that's right at the 3. And don't ask me what I was doing before. I thought maybe if I pulled back it would help get the air out, but it wouldn't let me pull back the plunger. Do it when that's what it is. You got to take the cap off first. I was just having a brain fart. Okay, and then I'm pushing up. And again, I'm going to go over the trash. But you got to hold it up high, not so that you don't want it in the trash can, up in the air. All right, and as you can see, that's right at the 3 milliliter mark. So I'm putting that down there. I have my Lasix, so 100 milligrams, 10 milliliters, and I need to draw up 4 milliliters. I just realized that this syringe actually only holds 3 milliliters. That's interesting. I'm trying to think if I have a bigger. I guess I'll just do 2 and 2. That's what I would do in real life. Just gotta scrub it again with alcohol. Okay, that's 2. 2. I'm going to put that back in. I have to label both of these. So Lasix 100 milligrams and 10 milliliters, and I'm supposed to give 4 milliliters to give 40 milligrams. So it's Lasix 40 milligrams per 4 ml. Okay, I need 3 alcohol pads. So at this point is where I would say to the CE that I'm ready for them to check my work. I believe that I have completed all critical elements, I think. And then I would have to wait while the clock is ticking and eating up my time while they review my medications and let me know if I'm correct or not. I see here that I didn't quite fill out this, so this is one cap, 2 tabs, and 2 2-milliliter vials, I guess I would write. Okay. And then I show it to them, and then hopefully they tell me that I can continue. I actually kind of want to put this off to the side. And this is actually, I'm going to clean my hands again because I'm going to touch a patient. You should always wash your hands. I need this actually to ID. So I put a little wristband over here on this little dummy that I have. So I can ID that this is Siri Vastus, medical record number 157896, medical record number 157896, and date of birth 61 years old. Okay, so I have the right patient. Hi, Mr. Vastus. I have a couple of oral medications that I'd like to give you. I'm going to first give you your stomach medication, and then I have your antibiotic. You could take this, and then this. Thank you. And now I'm going to give you your Lasix. All right, so I know that I'm giving 4 milliliters and it's over 1 minute. I have the order right here. Over 1 minute. So obviously it's 1 milliliter every 15 seconds. So I'm going to put on, maybe wash my hands again. Put on gloves. I'm already at the 15-minute mark, and I didn't even do the sub-Q, which I think we would be required to do in the real lab station. I don't think they would have us hold both of those in real situation. Okay. Clean this. Scrub, 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 scrub. All right, I'm going to take my first flush out of the package. Why do I leave them in the package? Because I have a really bad habit of touching the plunger when I'm trying to shoot the water out. Now that I'm ready to give it, I'll take it out. I'm going to connect. Hopefully you can see this. I'm going to connect. And I know that I need to aspirate. I forgot to check the site. So I need to do that before I administer this. I don't think I've passed a critical element yet because I haven't actually flushed it. All I've done is connect it. So I'm going to check the site. There's no redness and there's no swelling. I am going to change my gloves. I'm going to wash my hands. And I might as well just write it right here before, so I don't forget. No redness and no edema. Hopefully they would let that pass. Maybe they'd fail me, who knows. I'm going to wash my hands again. But I hadn't actually done anything. I hadn't administered it yet. I try to argue my way. Okay. So now I am ready. I'm going to aspirate. No, there's no blood. So now I'm just going to wait for the hand to go on the 9 here. So I'm at the 9 on my watch, and I'm just going to really slowly. I just would prefer to do it over the 15 seconds-ish. Okay. And I'm putting this into my sharps. And now the first Lasix, because I have to give it in 2 vials because I didn't have a big enough vial for, which I actually find that happens quite a bit with Lasix. A couple times I know I've had to actually do this in real life, do it this way, because the facility didn't have a big enough syringe. So I want to give 1 milliliter every 15 seconds. So again, I'm going to wait till the hand's on the 9. 9 seems to be my lucky number. Okay, I'm going to slowly. I know some people do that twisting thing. I just go very slow. I can't do that. It doesn't work for me, but whatever works for you. Okay, so I'm at the 12 and I'm just going over the 1. I'm actually a little behind, so I gotta kind of, but I know it's okay to be a little slow, you just don't want to be too fast. So I was about 5 seconds too slow. And again, this goes in the sharps. Alright, I'm doing my second Lasix. I gotta clean this again. It does, I believe it does say somewhere in the study guide or the scoring tool that we are supposed to do it after every thing, better safe than sorry for this. Alright, and I'm going to wait until the hand is on the 10 and I'm going to begin. Again, I just don't want to get 1 milliliter by the time the hand is on the 5. Okay, and now continue the last milliliter. I need 1 more alcohol. Flush. And again, oh good, I'm right on the 12, so I'm just going to slowly do this over the 15 seconds. I still, just to give you guys a heads up, I have 10 minutes left according to the clock. I still have to do my charting, finish my charting, which only should take a couple minutes, and write my note about the medications that I held. But just so you know, I only gave the IV push. I didn't give the sub-Q injection, which would probably be out of time by now if I did. This goes into the sharps. And I have to, again, just check the site to make sure there's no redness or no swelling. Take off my gloves, wash my hands, get rid of all my trash. So I want to write my name and my initials, that I held the insulin because the blood sugar was 135, and I held the vitamin K because the INR was 0.5. I can't really think of anything else I have to write for this particular lab station. I want to document, again, that there was no redness and no edema. I didn't do an IV mini bag, so I don't have to do anything with the flow rate. I didn't give an injection, so there's no site to assess for that, to document on that. So I need to sign my medication. So I did not give the insulin. I gave the Lasix. I gave the omeprazole. I gave the amoxicillin, and I did not give the vitamin K. So I believe that I am done. And I have 7 minutes left on the timer. And I am just going to quickly look at the answer key real quick to this. Lasix. I just want to double check the Lasix that I did that right. 10 milligrams. Oh, and 1 ml. I was supposed to give 0.4. Oh my goodness. That was my mistake because when I set this up, I wrote the wrong thing. So I just wrote the wrong thing on the vial, so that's why that got screwed up. Where is that bottle of Lasix? What did I do with it? Yeah, I wrote 10, this was 100 milligrams in 10 mLs, and it was actually supposed to be 10 milligrams in 1 ml. No, I'm sorry, I was right, 100 milligrams in 10 mLs. So 10 milligrams in 1 ml, and I gave 4 ml, so I did it right, I'm sorry. Okay. All right, so let's see what the answer key says. It looks like they did give the Lantus for glucose less than 150, so maybe that's a mistake. I don't know, but I know that it says to hold it if it's less than 150, and it was 135, but they gave it. That doesn't make sense. So maybe I'm missing something here. Lasix. They gave antidiuretic, patient has a history of heart failure. Omeprazole, 20 milligrams. They gave it proton pump inhibitor, patient has gastroesophageal reflux disease. Amoxicillin, they gave it, antibiotic. Vitamin K, 5 milligrams. Hold for INR less than 1.2. And they did hold that. For clotting, patient has celiac. Sub-Q site without redness or swelling, patient denied discomfort, vitamin K. And again, I am just going to check this lab one more time because I'm really confused. Excelsior, Excelsior, Excelsior. Glucose, 135 today. Hold for less than 135. I don't know, maybe it was just a typo or something. I'll have to send them a message at the message center, but I'll stop this.